talked about several key tests. Some patients may be confused about whether they've received these tests. So what questions should they ask their physician to make sure that they're getting appropriate testing?
I think it's probably useful because, not everybody needs every test. And I think, there are often things you hear about, online or from friends, or even in a webinar like this, and there may be a good reason why you haven't had that particular test. So I wouldn't assume, that just if you haven't had everything we've talked about today, even that like someone's made a mistake or that you need that and aren't getting it. But I would ask, I think it's always helpful to know more. Knowledge is power. And so if you have never had, a CT scan or a CA2729 level or genomic testing, I think it's not a bad thing, if you're curious about it, to just ask your treating team, hey, I heard about genomic testing. Is there a reason I haven't had that? Or have I had that? Maybe you have, and, they called it something else. I think it is complicated, but I think it helps to understand what you've had done and what you haven't had done. And sometimes asking about something like that may prompt the team to do things that may benefit you.